guys, I'm Sneha. I'm an occupational therapist and welcome to my channel, Sneha's Corner. So today, I'm going to talk about a very frequently asked question that is not only important for theoretical point of view, but we have seen this in our practical life too. Yes, we are talking about edema. So stay tuned till the end of the video to get a complete guide on edema.
So today I'm going to discuss about what is edema, its causes, its various types, how to evaluate it and what are the different methods of its measurement. As we all know, edema is a Greek word which means swelling. As we go through the definition, it can be defined as abnormal and excessive accumulation of free fluid in the interstitial tissue spaces located beneath the skin and serous cavities. As through this definition, we can see that they are located in these interstitial tissue spaces. These interstitial tissue spaces are the compartments which surround the tissue cells. They are filled with a fluid which are known as interstitial fluids. And whenever there is an excessive accumulation of this type of fluid which is called as free fluid, it's called as free fluid because they move freely. Whenever there is an excessive accumulation of this fluid, then it causes an abnormal swelling, and this abnormal swelling is known as edema. Or it can be also defined as a local or generalized condition in which the body tissues contains an excessive amount of tissue fluid. In this, the tissue fluid is the main component of extracellular fluid which surrounds the cell in the body. This extracellular fluid or ECFF contains plasma, interstitial fluids, water solvents, amino acids, lymph and many more. And through this definition we can see that it's a local or generalized condition. It means edema may be local or it may be in a generalized conditions. Now the question arises, what causes edema? What are its pathophysiology? So one of the major cause of edema is lymphatic obstruction. Normally, interstitial fluids in tissue spaces escapes by the way of lymphatics. As we know, in lymphatic system, it's a part of circulatory system and immune system which is mainly responsible for removal of interstitial fluids from the tissue. So, whenever there is blockage in lymphatic system due to this lymph node formation, as we can see in this, these are the lymph nodes. So, whenever there is a formation of lymph nodes, there is a disruption in the flow of this lymph in these vessels. So, this disrupted flow leads to the blockage of lymphatic vessels which leads to fluid retention, and this fluid retention ultimately leads to edema which is called as lymphedema. One of the most important example is removal of axillary lymph nodes in radical mastectomy which causes lymphedema of the affected arm. Other causes may be any type of tumors. So moving on. So some other causes of edema are like decreased plasma oncotic pressure. It's a form of osmotic pressure which is induced by proteins. It's mainly occur with hypoproteinemia or also in cases of renal edema. The next cause is increased capillary hydrostatic pressure. As we know, hydrostatic pressure is the pressure exerted by a fluid. So, whenever there is an increase in arterial or venous pressure, it leads to ultimately increase in capillary pressure. So, this increased pressure drives the fluid out of the capillary. Some of the examples is mainly caused in cases of heart failure. The next one is increased capillary permeability. As we know, capillaries are the primary site of exchange. So whenever there is a damage to the structure of these capillaries, they become more permeable or they become more leaky. Example like whenever there are burn or tissue trauma, it may lead to increase the capillary permeability. The next cause is sodium and water retention. In this, edema occurs because of the body's retention of too much salt or sodium chloride. This excess salt causes the body to retain water which then leaks into interstitial tissue spaces leading to edema. Some of the examples are like renal edema, cirrhosis of liver, etc. may cause sodium and water retention leading to edema. Now, what are the different types of edema? So, depending upon where the edema occurs, the first variety is localized edema. When the edema is limited to an organ or a limb, or when the edema is located at a particular region, like in right hand or in the left feet. So, this is called as localized edema. It may be caused in cases of lymphedema or pulmonary edema. The next variety is generalized edema, which is also called as dropsy. When the edema is systemic in distribution, particularly noticeable in subcutaneous tissue, it's called as generalized edema. As in cases of renal edema or cardiac edema, it causes a generalized edema, which is generalized in the body, not located at a particular region. Moving on, depending on the fluid composition, edema fluid may be also two types. First variety is transudate, which is the common one. Transudate is a fluid which is pushed through the capillaries due to high pressure within the capillary. This pressure is created by the osmotic pressure and it accumulates the tissue outside the blood vessels, which leads to edema, like in cases of renal diseases. The next variety is exudate. Exudate is a fluid that leaks around the cell of capillaries caused by inflammation. It's caused due to damage to capillary or blood vessels, like in cases of malignancy or inflammation. The next variety of edema is depending upon indentation. Now, what does indentation means? Indentation means depth or shallow or pit. So, the name suggests as pitting edema, which is the first variety. Whenever pressure is applied to a small area, the indentation persists for some time after the release of pressure. As through this example we can see, whenever the pressure is applied to a particular area, after the removal of pressure, it leads to a depth or shallowness or a pit. So, this variety is the type of pitting edema. It results from the water retention. It may also be caused with the problems of liver or kidney. The next variety is non-pitting edema. It's observed when the indentation does not persist. That is, when a pressure is applied, after the removal of pressure, there is no pit or there is no indentation present. Some of the specific conditions which leads to this type of non-pitting edema are like lymphedema, which we have already discussed. The next one is mixed edema, which is mainly due to hypothyroidism, and lipoedema. Lipoedema is mainly during the pregnancy or during the hormonal changes. As through this diagram we can see, the first diagram is of pitting edema, which we can see a pit or indentation here. But in case of non-pitting edema, there is no pit or there is no indentation present. The other types of edema which are caused due to disease of internal organs are like cardiac edema for heart, hepatic edema for liver, pulmonary edema for lungs, and renal edema for kidneys. So the first one, that is cardiac edema, it's caused when the heart holds excess amount of fluid which leads to swelling leading to edema. So whenever there is cardiac weakness, it leads to venous congestion. Venous congestion is caused when the venous outflow is obstructed by clotting. This leads to increase in venous pressure and this hence increases the vascular permeability, leading to fluid in tissue spaces, ultimately leading to edema. So the next variety is hepatic edema. It's caused in cases like cirrhosis of liver, which is associated condition of this hepatic edema. So whenever there is liver damage, it leads to obstruction in the portal circulation. It ultimately leads to the fluid in peritoneal cavity. Fluid gets collected in this peritoneal cavity, ultimately leading to edema. The next one, that is pulmonary edema. It is a condition which causes the excess fluid in the lungs. So whenever there is a pulmonary infection, it leads to pulmonary circulation overloading. This overloading increases the capillary permeability, which we have already discussed in our previous slides, and leading to edema. The next variety is renal edema. Renal edema, it's mainly due to the nephrotic or nephritic syndromes. Whenever there is acute glomerulonephritis, acute glomerulonephritis is the inflammation of glomeruli. It leads to changes in sodium and potassium ion, which ultimately leads to the water reabsorption, leading to edema. So these were the certain types of edema which are caused due to disease of internal organs. Now, how to assess edema? As we can see in this diagram, there are 4 grades: 1 plus, 2 plus, 3 plus and 4 plus. So the first one is that whenever we apply pressure to a particular area where edema is present, then there is a slight pitting, but after the removal of pressure, it disappears rapidly. Basically, the pit is about 2 mm depression, so it's 1 plus. The next one is 2 plus. When we apply pressure, it creates a slight deeper pit, but it disappears in few seconds. So basically, in an average, it's about 4 mm deep. The next one is 3 plus. So whenever a pressure is applied, it creates a noticeably deeper pit. After removal of pressure, it may last for 10 to 12 seconds or more, and it's about 6 millimeter deep. And the last one, that is 4 plus, it creates a very deep pit. It lasts for more than 20 seconds to rebound, and the extremity is grossly out of shape due to the swelling. It creates at about 8 millimeter deep pit. How to evaluate edema and what are the various methods of its measurement? Method is volumetric measurement. It measures changes in mass of the body part by use of water displacement. It has mainly 3 components. They are volumeter, beaker and a graduated cylinder. First of all, the affected arm is dipped in water, which is filled in volumeter. So this is the volumeter. Then the excess water transfers into the beaker. This is the beaker, and at the end this beaker is taken to the graduated cylinder, where finally measurement is taken, and at the end comparison is done of both affected and non-affected side. It's mostly used to measure hand and feet edema. Then the next variety is circumferential measurement. In this, a millimeter or a finger gauge is used to measure the circumference of the body parts not easily submerged. So those cases in which we cannot apply the volumeter, in those cases circumferential measurements are used. So these are the few examples. The first figure states a finger gauge. In this, with the help of this, we can measure the whatever the edema present in the finger. It has certain measurements in this, and if it is in the like in forearm region, then with the help of measuring tape we can measure. It's important to measure at the exactly at same places from test to test, and use of the anatomic landmark is very important to assess the placement. So this should always be kept in mind. Now the next technique, which is very much interesting, is figure of 8 technique. So it is time efficiency and cost saving at the same time. It needs only a measuring tape. Its measurement is recorded in centimeters, and for this one condition should be always kept in mind, that is wrist should be in neutral position and finger. Through this diagram I would like to explain the process of figure of 8. First of all, the patient hand should be kept on the table for stabilization. Then the initial position of the tape is kept on the ulnar aspect of the wrist, just distal to the ulnar styler process. Then the tape is then taken to the volar aspect of the wrist to the radial styler process, which is this one. As we can see, this one is the first position, this one is the second position. Then it's taken diagonally to the fit metacarpophalangeal joints, which is across the dorsum of hand. Then it's passed towards the second metacarpophalangeal joint towards the volar aspect of the hand. Finally, it's taken diagonally from this second metacarpophalangeal joint to the starting position, which was this one, towards the ulnar styler process. So ultimately we can see that In the dorsum of hand, it creates a crossover, this cross mark. And in the volar aspect, it creates a parallel line. Ultimately, we can see that 1, 2, 3, 4 and 5. So, it creates a figure of 8. Similarly, in this one, we can see this from the initial position 1, 2, 3, 4 and 5. So, it creates a figure of 8. So, this was explained. Thank you for giving your precious time.
If you like this video, give it a big thumbs up. Don't forget to comment below because it will give me an inspiration. The part 2 will be coming soon. Please subscribe to my channel if you haven't yet. Till my next video, be safe and be positive.